Hello, I'm Scott Flanagan here. For you childish people or acting like a bunch of 5-year-olds, um, what reason do you really think why I'm fat? May I ask? What kind of think I'm overeating, not getting enough exercise, or a lot of other things? Or just being just too lazy and don't want to get out and do nothing. Okay. Um, well, I have basically a medical issue. It's called a pituitary adenoma. It's a tumor on the pituitary gland. Okay. All right. I'm going to show you a few things here and some other videos I came across, and hopefully this educates you. Not every fat person is fat because they overeat or they're too lazy and don't exercise. You should really educate yourself and get more information about the person's reason why he's fat before you judge what they are and what they're doing. Okay? And I'm going to show you some pictures of my childhood here. Okay? Before I became overweight and fat. So I wasn't overweight and fat all my life. Okay? And here's some pictures, basically, yeah. Here's one of my school pictures when I was in school. Elementary school, elementary. I was probably 7 or 8 years old at 7 or 8 years old at the time. Okay? Here's my other picture of my dad, my real dad, eating a donut. I mean, that's how skinny I was. I was skinny as a twig. Okay? I mean, this was my real father. I was about 7 or 8, right there in the age line. I was pretty tall as a kid, of course. Here's another one. I was sitting on Santa's lap. I'm a little bit older, probably close to 9 or 10 years old, right there. Okay. All right. There's another thing. If you still don't believe me at this point, you probably. I think I'm just making up excuses, of course, like you always say. I'm making up excuses. Here's one of the drugs I take. Carbogaline. It is basically a dopamine receptor agonist. Okay, helps to my tumor, and I'm going to show a video here coming up. She'll explain to you what the pituitary adenoma does to you and your body. There's 3 types of tumors of that does different 3 different things to your body, and pretty much I fall in that category. I had an MRI done, okay, beforehand. Okay, and they didn't just I had the symptoms when I started I started showing symptoms when I hit puberty. Okay, we didn't know what it was. My mom's insurance didn't cover all the testing or what the reasons behind what was causing the symptoms. You know, producing milk in the body and enlarged breasts. My breasts were growing, gaining weight, and stuff like that. You know, those manufacturers. Well, they did little blood work, and it showed signs of a possible whatever they were thinking it was. But again, we didn't have the insurance to cover the other testing, like the MRI. They needed to take in my head to find out what was caused. They couldn't. It didn't. My mom's insurance didn't cover it at the time at all. Okay. After I got done with high school, I was found probably around let's say 98, year 1998. I went to a school up in Plainwell, Michigan, for technical school. Learn how to do basically electronic work, do repairs, stuff like that. because I was into a lot of computers at the time, and I didn't know how to actually fix computers at the time, though. I was trying to get an education to actually get a better myself for a job. Okay, which I was basically most of my before I went to school, I was having a hard time in high school. That's the reason why I didn't graduate from high school, is because I kept on falling asleep in class. And if you have the video explain the reason of that too in the video, of the reason why I've been falling asleep in class, can't keep awake, even though I got plenty of sleep just to go to school and everything, but I still fell asleep in class. I couldn't keep awake, regardless of how much sleep I got. The same thing happened to me when I went to the technical school, even tried to get my GED and diploma and everything else. And I was through Michigan Rehab at the time. When I went for the first semester, they basically, what happened, I had the same trouble falling asleep in class, and the state paid for my medical to find out what was wrong with me. And they actually gave me my very first MRI. That's when they discovered the tumor on my pituitary gland. They determined it was a pituitary adenoma. Okay. After we figured that all out and everything else, basically the counselor of the school sat down with me. She explained to me, in order for me to continue to be at the school, I would have to have it taken care of before I even come back again. That's how they explained it to me, because I couldn't keep awake in class. So, after I got back to again, they prescribed me the medication, the same medication you seen early on the screen. So, that's what that is. So, it's supposed to shrink the tumor down. The insurance, that basically the state was covering a bit until, again, you'll notice in the video this depression was one of the symptoms of the tumor, and being tired, and which I had a lot of those symptoms, and I was deeply depressed after being told I can't come back to take care of this, and after I take care of the tumor, taking the medication, and everything I was trying to get taken care of. I fell in a very bad spot in my life where I thought I just let everything go. I lost my spot at Michigan Rehab, and everything else. I don't blame anybody, but pretty much myself for that whole situation. What basically happened at that point, I just basically tried to get on with my life and try to get jobs and work and stuff like that, and try to make a living on my own without any going back to the school. You know, I had quite a few jobs. I've been working up to 2005. I've been in and out of jobs all over the place, and just a lot of most of my jobs. Had no more jobs than most of the year. A couple of them went last no more than a year. I got fired or something else, or I quit maybe, or temporary work only for a factory. Went through basically temp services. And done all that. Went through a lot of that until after the 9/11 thing. And it dropped off from that point forward. Because I had a decently good job for 8 months doing CNC work at over United Metal Technology, and after the 9/11, he let many people go after that happened. What happened? Not just me. And I was always hoping to get hired in. I was through a temp service, and I was doing a damn good job. And too bad he had to cut some people. With the tumor situation, I lost my state assistance with that situation. No more medication. Then finally, the DHS had the Adult Benefit Waiver Program. This is before the Affordable Health Care Act. Got onto it. It covered everything I needed to do, but it wasn't very easy to get onto neither. You had to be on top of it. You had to check on almost a monthly basis to see if there's an opening for it and apply for it. And once you get on it, and I got onto it, got my medication, did another MRI, got all that done, and started it again. Um, Somebody eventually down the road screwed up my paperwork at DHS. So I lost my medical assistance. So there goes the medication, the all that stuff. You know, and I lost again, and it took years again just to get back on it. This is close right before the Affordable Care Act started. Okay, because the last time I was done was in 2005. Okay, and that's when I lost my insurance around that time. Basically, when I get to the affordable health care, I mean, if I got back on that program, the adult benefit welfare program, I finally got back on it again and started to try to get everything taken care of again. It took time because the appointments and schedule took 6 months to a year just to get scheduled to see a doctor to have the tumor taken care of or get everything started. That's all it took for every time I went to go see a doctor. So it wasn't instant. I had to wait and wait and wait. Before I even got far enough before I got prescribed the medication, the Affordable Health Care Act kicked in. And it dropped my insurance for the adult benefit waiver program because DHS took on that Affordable Health Care Act. And then when I got on that program, went to try to start getting back on the medication and go see the endocrinologist and all that again. And after I got to the endocrinologist and he prescribed me the same medication, and he tried 3 different brands and generic types of the medication. None of my insurance would cover it. Even tried to have the doctor sign off on it. Only they were allowed one time to get it. And that was it. And again, I kept on, and I just didn't get it. I couldn't get it treated. And then eventually, I come to find out, the type of insurance of the affordable health care, there was like 3 types you can choose from through DHS. Somebody told me about Meridian Health Plan. Nobody told me about this until later on down the road. And I got on Meridian Health Plan through the Affordable Health Care Act, and it did cover my medication. See, but nobody tells you this stuff. You have to literally find out for yourself. But okay. Basically, let's get to the actual point of the story here. The reason why I am overweight. It's not because I'm overeating and like that stuff. Okay? I'm going to let Jennifer take it from here. She'll explain how the pituitary adenoma works and what it causes, and let you see what they'll explain. And hopefully this educates anybody and whoever who has the same issue as I do. And it varies between person to person. And just to let you know, some few celebrities had it. One of them is Andre the Giant, and the world's tallest guy, just to let you know. So you want to look that up, you can. I mean, those 2 people that had that same issue. All right? Just to let you know. All right. Here's Jennifer. She'll let you know what the pituitary adenoma does and what it does and where it's located.
The pituitary gland is sometimes referred to as the body's master gland. It's an appropriate nickname because this tiny gland acts as a control center for the body's endocrine system. Attached to the brain's hypothalamus, it bridges the gap between the nervous and endocrine systems by receiving signals from the brain and stimulating several hormonal pathways. It oversees growth and development and regulates the function of specific organs and glands. There are 9 major hormones made by the pituitary gland. For this lesson, let's review 3 of them, their function, and their target tissues and organs. ACTH, adrenocorticotropic hormone, targets the adrenal gland and stimulates the production of cortisol and aldosterone. GH, growth hormone, targets many cells in the body, and functions by stimulating growth and development. Prolactin acts on breast tissue and functions by causing the secretion of milk from mammary glands. Pretty impressive for a gland that is only about the size of a pea. An adenoma is a tumor of a gland, specifically in a gland's epithelial tissue. A pituitary adenoma is, then, a tumor of the pituitary gland. Pituitary adenomas range in size and severity, and their cause is unknown. Macroadenomas are over 1 centimeter. Microadenomas are less than 1 centimeter. Most adenomas are benign, and the ones that are malignant rarely spread to other organs or glands. They may be either functioning, that is, they secrete hormones, or non-functioning, which means they are simply growths on the adrenal gland and do not secrete anything. If you think about the 3 hormones we just covered, you can see why a functioning pituitary adenoma will likely have very profound effects on the body. Because the pituitary gland has so many functions, the symptoms of a pituitary adenoma vary widely. In this lesson, we'll address just a few general symptoms and 3 major conditions caused by pituitary adenoma. General symptoms of pituitary adenomas include those of many brain tumors. These are considered to be mechanical since they're caused by the physical pressure of the tumor on surrounding brain structures. These include headaches, vision problems, depression and other mood disorders, and fatigue. Acromegaly is usually the result of a functioning pituitary adenoma that secretes growth hormone. The condition comes from the body's inability to use its normal feedback pathway to stop the production of growth hormone and the cascade of other hormone pathways that it triggers. The word acromegaly literally means large extremities and accurately describes some of the symptoms of this condition, which include enlargement of body parts like hands, feet, nose, lips, and ears, as well as a protruding brow and lower jaw, joint pain, sleep apnea, and excess perspiration. If the pituitary adenoma produces too much prolactin, it's called a prolactinoma. Prolactin is a hormone that causes breast tissue to make milk. As in acromegaly, the prolactin pathway is usually under tight control by the body, stimulated by childbirth and breastfeeding. If not stimulated by these acts, prolactin production normally falls. In women, prolactinomas can cause galactorrhea, the inappropriate production of milk. That is, milk is produced even though a woman is neither pregnant nor nursing. Too much prolactin can also cause infertility and irregular or sometimes absent menstruation, amenorrhea. In men, symptoms of this type of prolactinoma are usually limited to sexual dysfunction and the general symptoms we discussed earlier in this lesson. A condition caused by exposure to high concentrations of cortisol, called Cushing's disease, is often caused by pituitary adenoma. In this condition, the pituitary adenoma secretes ACTH, which acts in the adrenal glands to produce large, uncontrolled amounts of cortisol. Excess cortisol causes weight gain, especially around the face and between the shoulder blades. People who have Cushing's also heal slowly, bruise easily, and may have difficulty controlling their blood sugar. As with symptoms, treatment of pituitary adenomas varies and must be tailored to the needs of the patient. For example, many non-functioning adenomas are simply monitored through MRI. Most macroadenomas, especially those that cause consistent vision problems, are removed surgically, specifically transsphenoidal surgery, entrance through the nasal cavity and the sphenoid bone at the bottom of the skull. Surgery has about an 80% cure rate, especially if followed by radiation. If the tumor is functioning, however, then the upset balance of the endocrine system is sometimes restored through medication. Let's take a look at some of the ways drugs are used to treat the conditions we've discussed. Adenomas that secrete growth hormone are treated primarily with somatostatins, a class of drugs that are synthetic replicas of the naturally produced hormones that prevent growth hormone from being released from the pituitary gland. Prolactinomas are treated, and treated very effectively, with a class of drugs called dopamine receptor agonists. Let's break that down into three parts. First, dopamine is a neurotransmitter. In the brain, one function of dopamine is to inhibit the secretion of prolactin. Second, an agonist is the opposite of an antagonist. Remember, the antagonist of a story is the villain, the character that works against the hero or heroine, while an agonist works with something. Third, dopamine receptor agonists bind to dopamine receptors when no dopamine is present. Therefore, these drugs function by binding to receptors on the pituitary adenoma, preventing prolactin from being secreted. It's important to note that if surgery can be done safely and effectively, it's often used as the first course of treatment. In the case of Cushing's, for example, surgery is almost always the preferred treatment. On the other hand, if the adenoma is very small, it's not uncommon to take a watch and wait approach. That is, to monitor the patient's health and treat symptoms according to need. Let's review. The body's master gland, the pituitary gland, is the control center for the body's endocrine system. Its jobs include overseeing growth and development and regulating the function of specific organs and glands. An adenoma is a tumor of a gland, specifically in a gland's epithelial tissue. Therefore, a pituitary adenoma is a tumor of the pituitary gland. These tumors range in size and severity, and their cause is unknown. Adenomas are sometimes classified by their size and severity. Macroadenomas are over 1 centimeter. Microadenomas are less than 1 centimeter. Most adenomas are benign, and the ones that are malignant rarely spread to other organs or glands. They may be either functioning, that is, they secrete hormones, or non-functioning, which means they do not secrete hormones. The symptoms of pituitary adenoma vary widely. Non-functioning adenomas usually cause symptoms similar to those of most brain tumors, including headaches, vision problems, depression and other mood disorders, and fatigue. Symptoms of a functioning adenoma depend on the hormone they secrete. 3 examples of conditions caused by functioning pituitary adenomas are acromegaly, caused by excess secretion of growth hormone; galactorrhea, caused by prolactinomas, which secrete prolactin; and Cushing's disease, caused by excess secretion of ACTH, which in turn causes excess cortisol production. Treatment of adenomas also varies, with surgery being the most common. Specific drugs are also used for functioning adenomas. Specifically, somatostatins are used to treat acromegaly and dopamine agonists to treat prolactinomas.
Okay, welcome back. All right. Now, I hope you got a better understanding what my medical problem is, and the reason why I'm overweight. Okay. Well, they explain everything else to you, the medication, and the surgery, and stuff like that. And it's like people had suggested me to do the gastric bypass surgery, or do the surgery for the pituitary adenoma. Okay. I'm going to show you basically here. Basically, it's not good to be doing surgery for my weight whatsoever. There is a high risk factor in it, and I know surgery has high risk factors. I'm going to have another person explain that to you about that whole situation also. Okay, all right. I'm going to show you my current weight right now. That's my current weight. Okay. All right. I've been trying to work at it. I got off the pop, basically. I've been drinking diet pop. And I say diet pop is no better. It just basically, it's basically carbonated water that Diet Pop is. Okay, there's no difference between the clear carbonated water you see on the shelves at all. You can read the label and you'll see. Aspartame has side effects, but I haven't had any of the side effects at all with me whatsoever. So, I have lost at least 20 pounds since I've been off that. And been drinking that lately. I still need to work on my dieting and what depends what food I have to eat. But I still got to work and get a little more exercise, of course. I do need exercise. Yes, I agree with most people on that too. And it's like I explained before, because of my pituitary, it's causing a lot of issues in my healing, like the wounds on my leg. I had over a year now, and it still hasn't healed yet. And that's because of the pituitary adenoma. So, okay, trying to think of anything else to explain to you about on this point. I'm going to let basically the doctor explain the reason why. It's a high risk factor for me to go under anesthesia for any reason. It's not good for me. Okay, and basically here's that video.
Overweight.
There are serious risks for obese patients who undergo anesthesia. When a patient is overweight, they will take longer to wake up from anesthesia. They have a higher risk of blood clots, respiratory failure, and operating room bed positioning injuries. Even obtaining an accurate blood pressure measurement is difficult because most blood pressure cuffs will not properly fit an obese patient. It's also hard to introduce intravenous lines in obese patients because it's simply difficult to find the vein. Pain control is also, unfortunately, more challenging to control in obese patients.
A patient is considered obese if his or her body mass index is greater than 30. Body mass index, or BMI, is a measure of body fat based on the height and weight of the patient. Illnesses associated with obesity, such as type 2 diabetes, obstructive sleep apnea, hypertension, and cardiovascular disease, can have serious implications for patients requiring surgery and anesthesia.
In the operating room, placing an airway tube such as this one and helping patients breathe can be quite challenging. In addition, obese patients may have sleep apnea, which means that there's an obstruction between their windpipe and their mouth, making it difficult to breathe while sleeping. This condition becomes more exaggerated with general anesthesia. It can also be quite challenging to place a breathing tube known as an endotracheal tube because of the excessive soft tissue in the mouth and in the throat. Patients with sleep apnea may not be good candidates for some outpatient surgeries and may require overnight stay to monitor their breathing. Anesthesiologists such as myself anticipate these difficulties and prepare for them and counsel patients regarding potential complications.
Obese patients who are scheduled for surgery should discuss their condition and their options with their physician.
Okay. Alright, welcome back. This again. Basically, I hope you have a better understanding of my situation and stop acting like a bunch of 5-year-olds. Because you might want to make sure you want to see the reason why behind these people, why they are overweight. They have good reasons why. It's not all because they could eat or their diet and stuff like that. They might have an actual medical issue is causing it. If you still don't believe this, I'm sorry. I can't help your ignorance whatsoever. If you didn't get educated from this video and not look it up yourself, the information, why don't you ask your doctor? Go to him and ask for those about that. He'll tell you the same thing. He might give you as much as he knows, but remember, you have to really talk to an endocrinologist what it does. Yeah, I'm overweight. Of course. But again, if you want to consider what you're saying to people and your ignorance is bad. I mean, it's just, come on. Stop acting like a 5-year-old. Grow up. Don't call and tell me I need to grow up. I have grown up and I've been through a lot. And I'm still having trouble struggling out here. Okay. Pretty much, I hope you find this video helpful. Please like and subscribe. Share if you can. And I hope you all have a wonderful day. Alright? Thank you for watching.